Good to have you with us in the 9 p.m. edition of the Urban Debate. It's Friday and we're going to have another conversation about one of the biggest issues that we never ever talk about, and that is our mental health. It becomes even more imperative to address this issue in times of a pandemic. So many conversations, so many discussions, so much reportage, so much of the policy making is about the physical impact of COVID. But we often forget the mental impact that this pandemic is having on us. And today we continue with that conversation. We've had a series of different angles that we've explored. Today we talk about how in the last 1 year and 1.5 years, there has been a rise in sales of neuropsychiatry drugs, which effectively shows you that there has been a rise in cases and conditions, mental health conditions that need psychiatric treatment, that need drugs to help people. For the month of April to June, the jump was about 13% in the sales of such drugs. It's the sharpest that we would have seen in the last 1.5 years. Experts tell us, and we're going to talk about it, how issues and conditions of grief, depression are on the rise. Post-COVID illnesses are pushing people to rehab centers. Lack of awareness and hence anxiety, lockdown, isolation are various factors which are causing this rise. Essentially, this report is just another indicator of what we've been fearing and what we have been telling you. That this part of the pandemic impact needs to be addressed, that there will be more people who undergo severe conditions and issues regarding their mental health. The grief that this nation has seen in the second wave itself will lead to a lot of these issues. And that's now visible, not just for the second wave, but even in the last 1.5 years. It's visible in the way your drug sales have gone up, whether it is for antidepressants, whether it is for other conditions, antipsychotic, analgesics, all of it. Let's talk about it. The only way we will be able to tackle this issue is first to begin by having a conversation and then talking about the possible solutions or how to at least create a support system, create a policy system that helps people in such times. Dr. Nitin Kondapuram, Senior Consultant Psychiatrist at Aster Prime Hospitals in Hyderabad, joins us this evening. Dilshad Khurana, Psychologist and Head Counselor for Empower One-on-One Helpline. Abdul Mabood, Founder and Director for Snehi, which focuses on mental health care. It's a helpline. Dr. Deepthi Shah, Consultant for Psychiatric, associated with the AIPC helpline as well. Dr. Yashaswini Kamaraju, Child and Adolescent Psychiatrist and Director for the REACH Clinic and founder for the REACH Foundation, joins us this evening. Thank you so much to all of you for joining me in another round of this conversation. Dr. Deepthi Shah, let's start with you. And we've been addressing various aspects of it. We just thought that this report that has come out about the rise in drug sales is also indicative of what we are seeing on ground. But perhaps you can tell us as well if, the number of queries, the number of people reaching out, and serious cases of various conditions have actually gone up in the last 1.5 years.
Yeah, a very good evening to all of you. Yes, I completely agree that the number of cases have has gone up very significantly. In fact, during the first wave, we did not see so many patients, but in the second wave, we have actually had patients who were hospitalized for COVID, and we had to treat them online while they were hospitalized because the second wave has taken a toll. In the second wave, we've also seen a lot of grief and bereavement because sudden deaths have led to a lot of families being shattered, and that has also led to a lot of increase in depression, anxiety, and those kinds of illnesses. Of course, as the drug sales are showing us, but we do see a lot of increase in patients that we are seeing in our clinics and in our helplines.
Okay, and in fact, Dr. Nitin, would we also say that there are more cases of serious conditions where psychiatric treatment, counseling, consultancy is required?
Absolutely. In fact, what we are seeing is that
Yes, there
when
are a
there
lot of
Yes. Deepthi, let me just take that question across to Dr. Nitin Kondapuram. Yeah.
Yes, the serious psychiatric illness also have on the rise because of the lockdown. The patients were not able to visit the psychiatrist, and many of them were not able to do the online consultations, and that led to a lot of drug relapse. And because of that, they had increase in the seriousness of the conditions, and that was a major kind of a challenge for majority of the psychiatrists in all over the country, and that has impacted a lot.
And have we managed to find a solution to that problem, Dr. Nitin? Because even now, face-to-face
Yes.
consultancy is very difficult. Most people who are locked up in their homes with families and everybody working from home would find it very difficult to even speak from home in those conditions.
Yes. So the teleconsultation guidelines have been changed a lot. Video consultation, now we can also do an audio consultation, because of which many patients can consult a psychiatrist over a phone call or a video call. But the only thing is, like, people are not able to find that sources. They are reaching out to the helplines, but when it comes to the second visit or the second consultation, they charge a little amount of time, and people, because of the limitations in their money, because of the pandemic issues, they are not able to follow up with the same psychiatrist. So they go to a different psychiatrist. So every time the cycle starts. So whenever the cycle starts again, you start from the history taking and everything. And that is impacting a lot, because like people are not able to go and reach out to a psychiatrist and pay the money for them. So majority of them are reaching out for the helplines. Yes, there is a change in this in the last 3 or 4 months. People are reaching out to the psychiatrist, but at the same time, majority of the psychiatrists and clinical psychologists are busy with no slots with them. That shows the enormous number of consultations they are doing.
Okay. We've been also trying to read up on what are the kind of conditions and hence try and understand what would be the symptoms that people need to watch out for. Dilshad Khurana, psychologist and a head counselor for Empower, what are the kind of issues that more people are coming out with and approaching you with? And I ask this question because for the viewers who are watching us, it would perhaps be able for them, it would be easier to connect, to relate, and then understand what they may be going through.
So, as you rightly said, initially, issues that are coming out now, thanks to the second wave, are more about grief. Of course, it was very unexpected grief because people have seen, close friends, family, neighbors of all age groups, just succumbing to the disease overnight. So there's mass grief, there's anxiety, there's of course, a whole lot of frustration because, we just seem to be going around in a loop, with no end in sight. I mean, the third wave is around the corner. So these are the kind of issues that people are talking to us about these days. And of course, there's also the, ongoing frustration of job losses and no sight of career and future uncertainties in those areas as well. So those are the kind of issues we've been talking about.
So, job loss, uncertainty in terms of career, obviously grief, loss of a family member now becoming a big issue, prolonged isolation and anxiety about what may happen next. Abdul Mabood, also a big factor here. But how do people tackle this, especially somebody who's gone through a loss of a loved one and perhaps not had the time during that period to even understand it, process it, or grieve about it?
I would like to say very clearly, because we have been getting a lot of calls or helpline for last 1 year, because we started last year in April itself. The issue is that if you are talking about the rise in the medicines consumptions, you see the two things have happened. What we have been reported by the people who call us, that look, previously on counter medicines were not available because usually the medicines used to be given on the prescription. But since due to the lockdown and the teleconsultations, this has become very easy for the people. to go and get the medicines. Second thing is that we should not forget this fact that in our society, over the decades, it has been developed that for anything and everything, you take medicines and you get well, even not consulting the doctor. Many people say that, look, even their family doctors are prescribing now a lot of psychiatric medicines. They are going because, of course, we don't have much psychiatrists in this country. Plus this lockdown, the people are not getting reached to the psychiatrist, and the hospitals are closed, or the OPDs are not running the way it has been running. So these are all factors we have to take in our mind. Another thing is that, look, the problem is huge, and the solace or opportunity to get help is very, very less. People don't know what to do. Because you see the amount of the people have lost their job, the people have lost their the nears and dears in the second phase. If you talk to the people, everybody, you will find those who call us, they have some or other known relative, distance known, they have lost somebody. Plus they have also experienced the anxiety, the desperation, the people running around, not getting any help, even the minimal medicines or the oxygen, that also passing through in the people's mind. Another thing that, look, there is a perpetual threat the people share about the third wave, the projected third wave, and they don't know if anything will be happen better or not. And fifth thing is that, look, everybody has to go and fetch their livelihood. What to do? How long one can remain? You have to go to the market. You have to go to the offices. There were the article that, look, viruses were coming from the office to the home. So that is also the people are so much in anxiety. And another thing is that, look, now the time is passing. The stress is day by day building up. It is coming to the surface. People are looking for the help. They're not getting help. And most unfortunate that, look, we don't have resources. You see how much psychiatrists we have in our country, how many trained counselors we have in our country, how many psychologists we have in our country, and the demand versus, you can say, the supply is so minuscule. So what to do? The people go to even their family doctors, any practitioner, and now they are also seeing that, look, people are so much uncomfortable and they are not getting any help. So they are also prescribing these medicines, and people are going and buying, and unfortunately the people are taking that medicines and with a lot of side effects, but those who are prescribing, they don't know how to manage it, because many people call our center and our helpline, they say, look, what to do? Certainly we are not here doctor, we are not here psychiatrist, and the people are not getting time to go to visit the psychiatrist. There are many reasons. So these are the reasons we have to understand that why the consumption of the medicines have gone up. Another thing that, look, very unfortunate that mental health is one of the most neglected area of human sufferings. Neither the government is thinking, nor the society is thinking, nor the big corporates are thinking how to help the people. And believe in that, look, if a number of the helplines being open in our country so that the mass level people can reach out, because now the telephone density has increased in our society like anything. People, if they have a helpline number available or they in their knowledge, it comes, they call. And now who are calling? Those who are on the social medias, because people are also not reading the newspaper. It is not being given in the newspaper. So the question is that how to reach out. For example, now you are saying you are doing this program, but how the people will reach out to us? They don't know our numbers. How they reach out to the other counselors and the other psychiatrists who are running the helpline. So this is the biggest issue in our society. Unfortunately, the government is not doing anything on this. Every effort of the government has limited to the vaccine and the managing the hospitals, beds, and the of course that is a very prime and paramount, no doubt about that thing. Yes. But what is happening behind that? Nobody is thinking. There's no discussion. No media is writing. Okay, yes, this is the second time you are doing the program. I'm so thankful to you. But you see the all mainstream media, they are not talking about even this thing. See the newspapers in Delhi, the all major newspapers. I have been searching sometime that anything I will get out of this. Nothing is happening. Very unfortunate situation. Last time when the Sushant Singh Rajput case was there, you'll be surprised in those 2-3 months, so many suicidal calls we received because due to such a irresponsible reporting by the media about the one case, about the one suicides. So that is happening. somewhere the media has to also come forward, because now our society needs to be aware about this thing. They need to be aware about that where is the help is available, how much help is available, and more that look, unless until there is something on the government level, all the medical colleges of, or schools of this country is not going to teach the psychiatry. They are not going to teach the psychiatry and mental health at the MBBS level, at the graduate program. How is it possible?
So you're right there, Mr. Mahbood, and I think those are some of the things that I wanted to talk in detail here as well, of how do we solve this problem. I think from what all of you have said so far, and Dr. Kamaraju can come in on this as well, there is also a big problem, Dr. Kamaraju, of access and availability of the right kind of help. And if they're not available, then that's just adding to the problem and perhaps leading to a further rise in cases.
Yes, I totally agree that there has been a big disparity in terms of availability and accessibility of services. We do know that in metropolitan cities, definitely the psychiatrists or the counselors and therapists are much more concentrated as compared to the other places. And also in terms of psychoeducation and in terms of awareness, it's much more in bigger cities compared to smaller areas. So this creates a lot of disparity. So what we need to do is psychoeducation. I mean, you're already doing it. So psychoeducation in terms of newspapers, print, all forms of media. And the other thing is the psychiatric care needs to be integrated with the primary health care. A person with COVID is hospitalized, is extremely anxious about his recovery. We did hear about doctors counseling them. We did hear about nurses counseling them. So if we want to treat psychiatric issues, we also need a care coordinated plan. We need integrated setup. So we need emergency care. So we need screening at all levels, immediate care, emergency care, chronic rehabilitation. And when we integrate the services to the overall health setup, we would be able to deliver services in a much better form.
Okay, let me take this back to Deepthi as well. Deepthi, on one aspect that you raise, and I want to now dwell on that further, is the kind of help that people needed while they were still in the COVID ward. And obviously there have also been a lot of cases where it's been post-COVID, 1 month, 2 months, 3 months later, also people are beginning to show some symptoms. Let's talk a little bit more about that aspect.
Yes, so post-COVID, we are seeing a lot of symptoms of anxiety. We see a lot of physical symptoms actually. They come up with breathlessness, they come up with gastrointestinal digestive system related symptoms, sleep disturbances, appetite disturbances, headaches. So a lot of physical symptoms, but actually the cause is at a psychological level, at a functional level. So those kinds of post-COVID anxiety symptoms, somatic, psychosomatic symptoms we are seeing. Of course, we are also seeing more serious illnesses post-COVID. There is a relapse of a serious mental illness which the patient might have had earlier. So those kinds of serious illnesses we are seeing. We are also seeing a lot of grief reactions in terms of, not accepting reality, talking to the person who is deceased already, getting into very abnormal grief reactions. So these things also we are seeing post-COVID, because while they had COVID, they have probably lost a family member. They have not been in touch with that person who had COVID or is now deceased. So that isolation is creating a lot of trauma in terms of grief reactions that are happening. So we are seeing a lot of post-COVID problems, and patients who are in the hospitals for COVID, they are also having a lot of anxiety, sleep disturbances. Many a times their hyperventilation is more functional, more psychological related rather than COVID related. So that these are the common things which we are seeing post-COVID and during COVID.
Okay, so I am going to take that part and take it across to Dr. Nitin also. Dr. Nitin, often for people who don't understand or are not, very well aware of the various aspects of psychology, psychiatry, would say that, well, if you go through a tumultuous time and a tough time, you're bound to feel in a certain way, bound to feel anxiety for a few days, or even, some of the other symptoms which are there, including digestive issues. But does that mean I need to go to a doctor and get, some pills or get on to drugs for my mental health conditions? What would you say to that?
Yeah, everybody has anxiety. You go to any exam, you definitely feel anxiety. Anxiety is there in everyone, but few of them, they have the anxiety more than what we call as a normal line or the baseline. And above baseline also, majority of them will have a mild to moderate kind of an anxiety where the pills are not required. But at times, when you feel that the anxiety is more than, say, for 2 weeks, or you're feeling low mood or decreased energy levels for more than 2 weeks, that means that yes, there is something wrong going on, either physically or psychologically, and it's better to go and visit a mental health practitioner nearby. And going there and speaking to them will definitely help you out. And we need not be stigmatized about that, because all the information what the patients tell to us will be 100% confidential. So it's like, just see that if it is more than normal and if it is different from what you are being happening in the last 10 days, then definitely go and reach out for the help. And there are many people who are helping out right now. There are many helplines, as sir said just a few minutes before. You just need to search few of the things on the Google or on your mobile phone or in the newspaper. You will definitely get those helplines and you can reach out for the help with them.
Is that something, Dilsha, that you've also come across even now? You know, people who do reach out, who do call, still are under a pressure of stigma or concerned about what it would mean to everybody around them.
Absolutely, absolutely. In fact, that's the whole reason we even started a live chat counseling service at Empower, because we realized that even talking on the phone is difficult for a lot of people, and especially in a situation like this where people are in the house with their families, and it's even difficult to talk on the phone. So yes, stigma is a very large concern. In fact, I think more than having access to resources, I think the stigma is what, or the lack of psychoeducation is what is preventing people from reaching out and seeking help.
So how do we fix that? How do we fix it at such a time when it is even more important for people to come out, but it's also very difficult because we ourselves are so restricted, interactions are bare minimum, everything is taking place on Zoom calls or on the virtual platform, and so it becomes difficult to sometimes break down those barriers. Let me actually take that question across to Dr. Kamaraju.
See, we need to understand that COVID is a syndromic problem. It is not a single virus. We have understood it's a new virus. We're getting to understand more about it as we're seeing second wave and possibly a third wave, which everyone is worried about. It is affecting the heart, kidneys, it's affecting the brain, because of the immune effects and hypercoagulable states. So it also affects the brain. So any doctor who is treating the physical aspects of the virus also needs to look into the neuropsychiatric aspects, implications of the virus. So we are having enough data right now that the COVID is also affecting the brain. So people are coming up with brain fog, which is very well documented. There is worsening of dementia, there is delirium, there is agitation, anxiety, forgetfulness. So, and there is increased anxiety and depression in people who have never had such problems prior to COVID. And the psychiatric manifestations could even go beyond 6 months. We understand it's a multi-organ problem and not related to just a liver or a kidney anymore, or a heart. So it's involving all the body organs, including the central nervous system. And have this kind of an understanding, we also look at the treatment plan from a neuropsychiatric standpoint. So this has to come from a treatment protocol, which needs to include a screening for psychiatric problems, screening for psychological distress and emotional distress, along with the regular loss of taste, loss of smell. So psychiatric and emotional questions also need to be in the screening and also need to be in the treatment protocols.
Would you agree, Dr. Deepti Shah, that this could perhaps become a proper, official part of the treatment protocol? Some may be doing it, but I highly doubt it's taking place at a larger level.
Absolutely. I don't think it's taking place the way it should be taking place. And that will be one way of addressing. But I think, again, stigma for psychiatric issues has been a long-standing problem, and we need to address it apart from just at the treatment protocol levels. I think importantly, what we have been doing is addressing certain specific groups, like we have been addressing teachers groups, we have been addressing other professional groups, social organizations, Mahila Mandals, and those kinds of organizations through social media, through Zoom webinars, and trying to educate them about anxiety and depressive symptoms. We are also helping them with the basic supportive psychotherapy through these Zoom sessions in mass at the mass level, and beyond that, what else? How can they reach out to professionals? We are trying to psychoeducate them. So psychoeducation is very important, and we also believe that reaching out to friends, reaching out to family for their issues, and family and friends supporting them and helping them to reach a mental health professional. These are the ways to address the stigma, because stigma is the major problem. A lot of people who reach out to us, they reach out to us through second, third person. When somebody says no, please do it, then somebody will say don't go, then again somebody pushes them, and then they reach out to us. So many a times it is too late. They come to us when they've gone through already a lot of distress, lot of trauma, which otherwise could have been addressed very easily if they had reached out on time. So stigma is something which, through social media, through newspapers, through media, and through doctors, through various organizations, we need to address and dispel the myth that not every person who goes to a psychiatrist is a mad person. Stress, anxiety, depression are issues which any person, everybody, regardless of caste, creed, race, color, is going to face, and it needs to be addressed at the right time, so that we don't face the consequences of these issues.
Yes. So then, Abdul Mabood, since everybody can face this issue, most of us would have gone through some moments, if not on a longer term basis, at least in the last 1.5 years. At what point does a person then decide, okay, now I need to get help? When do you say, okay, now I need to perhaps go to a professional?
Look, it is a very good question you have asked. But before that, I would like to address you the stigma part. Because look, stigma is one thing which really play a very hinder role. I will tell you one example to you. That look, on a helpline, we do run the decentralized helpline with the help of the software. So the caller telephone never comes to us. We don't know about that, though it is being called on the mobile. But I'll tell you, we would have received more than many dozen calls from the professional, like the doctor, nurses, and the people in the bureaucracy, and they purposely call on the WhatsApp call. This we really, when we realized that why such people call, then I talked to one doctor. I said, look, why you have called rather than you have called our the telephone number? He said, look, this WhatsApp calls give a lot of anonymity because this cannot be recorded, this cannot be identified. Something he was talking to that. What I'm trying to convey that, look, it's not only the common people is carrying a stigma, even the people, those who are working in the COVID center, they have so much stressful time, and so much you can't believe. I'll never forget talking to one nurse, senior nurse. He was saying that, look, and the amount of uncomfortability she has, because every moment she was saying somebody is dying and there is nothing to be given to the persons. So this is, I'm talking to the stigma is so much, they never call by thinking that their mobile number will come, rather than they were calling on the WhatsApp call. Another thing I'll tell you that, look, the people certainly come a lot because the pressure is so much. They don't feel comfortable in talking to the families because they're not sure that whether the family and friends will understand them. Another thing that, look, many people share that, look, they have been in the society very a strong person. They have been projected in their office, their setup, their business, being a strong person. But now due to the situation, whether there's a problem at a business, within the family or relationship, or being at home all the time, within the family, with the conjugal life, they don't want that to share with their friends and their relatives. They will, tomorrow they will feel there is not a strong person. So they call the numbers. And another thing I'll tell you, because the people from the rural areas, when they call and when you find at the helpline that, look, you can't do justice to or you can't help beyond a point, because the helpline has own limitation. You can't help any person beyond a point. and you say that you go and locate someone who is a mental health professional. There's no mental health professional. I'll tell you, in the state like the Bihar, you know the Bihar, how many district town has a mental health professional, a psychiatrist? They don't have. Now you will tell that you go all the way to the Patna. Even in the Patna, how many psychiatrists are there? Even they travel 300 kilometers or 400 kilometers from Purnia to Patna and all sorts of things. Or like the UP or any, and you go anywhere in Rajasthan, we have seen. The question
in
is
fact,
that
in fact, if I may just add there, I'm sorry to just come in, but if I may just add to what you are saying, Mr. Mahmood, because we've had panelists on many of our previous shows who also said this, that, a lot of these conversations that you're doing are so city-centric and so elite-centric, with people who can actually afford to think about these issues and afford to pay for any kind of professional help. Otherwise, in our country, like you said, in most part of the smaller towns and rural parts, there is absolutely no acknowledgement that this is also something that they must address. To you only, Mr. Mahmood, yes.
Yes, they have to address. You are very right. You see, in the city of the Delhi, I can say that 30% psychiatrists, their cost of consultation is so much high that a common person cannot afford to go over there. Believe it or not, even the psychotherapists, their charges are so high they can't reach over there. That is the biggest, you can say, obstacles in the seeking help. Another thing, if you go to the government hospitals, Department of Psychiatry, see the number of vacancies, the number of the sanctioned posts, and number of the people over there, the doctors over there. That is another issue. Who will take care of this? Certainly the government has to take care of this. Another thing, that look how many the hospitals have the ward or they have the facilities where they can treat the people, keeping them in house, admitting them. So there are big issues. Believe it or not, if you are sitting on the helpline, you will feel so much incapacitated that you can't believe in that. In the city like the Delhi, they are the professionals who are charging for one consultation 3,000, 4,000 rupees, even to 5,000 rupees. People have told like this thing.
Right.
How many people can afford about this thing? So
right.
This is a big disparity, big, you can say, the non-availability of the services, and more than that, people are suffering. Numbers are rising, and particularly after this pandemic, the fear, the anxiety, the stress, the even coping with the given situations and the post-COVID situations. What you will do about that person? Because the counseling cannot help a person, whatever they have a psychosomatic and the more, a lot of physical issues. So
right.
these are the issues, these are the scenario which is rising day by day, and unfortunately, neither the government nor state government are doing anything. Very unfortunate situation is there.
Well, I think it's only because only once we start to talk a lot about it will it actually fall on their radar. And often that's how a lot of policy reactions really come through, is when more and more noise is generated, people directly or indirectly via media or directly reach out to the state governments and the central government to say that, okay, we need this support, we need this help. Like, for example, there was much conversation about including mental health in your insurance cover. A lot of people even now wouldn't know whether that is an option for you or not, even though the policy to that extent has changed. So I do believe, yes, you're right, that the governments need to come in as well on the policy making front, even on setting up more colleges, setting up more courses, so that we do have more psychologists and psychiatrists in our country, would hopefully bring down the cost barrier as well. But I want to just now very quickly address the other part. When do you reach out for help? Dilshad, when do you know that now is not just about talking to your family member, to your friend, or even calling it to a counselor, but now is when I need to go see a psychiatrist?
So I think when you're talking about reaching out, I think any time is as good a time to reach out, because the minute you're not feeling okay, the minute you're not feeling yourself, the minute you feel like something's coming in the way of your daily functioning, I think that is when you should reach out. And there are a whole lot of free helplines available. There's no harm in just picking up the phone and asking, is this something I need to look into? And of course, then, when you are guided correctly, when you are given psychoeducation by an expert, is when, then you will be guided whether you need to see a psychiatrist or not, and, then take medication and go, that much further. But when it just comes to plain reaching out, I think, there is no fixed criteria. Of course, I mean, clinically there is a criteria doctor was just saying that, if something is, not okay for a prolonged period of, say, about 2 weeks, then yes, it needs to be looked into. But I would still go ahead and say that, right now, because, it's so prevalent, and because of the stigma, I think just the time that you feel like you want to unburden yourself, you want to talk about something, you don't have those resources to talk because of, all the issues that we've talked about, that's a good time to reach out, according to me.
And then comes the next question, Dr. Deepti. One is, when do you reach out? And the second is, to whom? And how does a person who's not able to process what they're going through or understand the symptoms that they're seeing, how do they decide who do they need to reach out to?
Yeah, so I think when do they need to reach out? What we normally suggest is when there is socio-occupational impairment. So either socially you are facing any impairment, you're not able to talk, or when you're talking, you suddenly start crying, you're not able to communicate well. That is social impairment, and occupational impairment, that you're not able to focus on your work, you're having too many absenteeisms. So socio-occupational impairment is the criteria for a person to reach out to a mental health professional. Who should they reach out to? I think whoever is available to you easily and very quickly. That easy accessibility is the person that you should reach out to. So if you have a psychologist or you have a psychiatrist in the vicinity where you can locally go in person, that will be the best thing to do. In case you do not have, then reaching out to any of these helplines where you can talk to a mental health professional, and then they will guide you whether you need to continue talking to a psychologist or a counselor, or you need to go to a psychiatrist. One of the red flags, of course, is when you have negative thoughts like suicidal ideas, then definitely seeing a psychiatrist is much more appropriate, because many a times that is something like an emergency, that's like a crisis situation which needs to be managed immediately with the help of probably medicines, admission to a hospital. So suicide would be definitely a red flag alert for a person to directly reach out to a psychiatrist. If you're not able to reach a mental health professional, then even your family doctor, just to talk, just to get a guideline, it will be good to reach even a family doctor so that you can be guided further. So reaching out to a professional who is easily available to you would be my suggestion.
Let me also bring in Dr. Kamaraju. Dr. Kamaraju, similarly, for parents to be able to decide for their children, at what point do they decide that, okay, now maybe there is something wrong that we're not able to understand and we need to figure out what it is?
See, what we're seeing during the pandemic is psychological distress and, of course, psychiatric conditions. Not all distress requires a psychiatrist. So there needs to be a triage system, screening, be it a helpline, be it an NGO, be it a doctor or a counselor, need to understand who is the individual requiring intensity of treatment. There could be a lot of individuals who might benefit just with therapy alone, psychosocial support in the form of friends and family, or enhancing their coping skills, or with a few tips, because the whole community is affected due to the pandemic. There is pandemic anxiety, there is pandemic fatigue. So not all of them need to reach to a psychiatrist. But an individual, as Dr. Deepti mentioned, there is a functional impairment, you need to go to a psychiatrist. So with children, you're looking at the home environment. So children's emotional and behaviors are definitely impacted by the parental stability. So if parents are not stable, obviously the child's behaviors could be affected. So here we're looking at if the child is angry, irritable, aggressive. Is it a temporary phenomenon because there is an unrest in the house, or maybe mother is not available, take care of the child? There's no one the child could talk to or spend time or play with or even share. So the loneliness and the social isolation is definitely causing a lot of break it down.
Yashasvi Kamaraju, I'm going to come back to you in just a bit. We have some bit of an audio issue with you where the audio keeps dipping, so we're not able to get, all parts of what you're saying. We will fix that and I will come to you. Dr. Nitin, let me bring you in on this as well. And, the more that we hear about it, the easier it is for people to understand. At what point do I say that this is not just a momentary or a short-term issue? There's anxiety all around us. There is, unfortunate news, heartbreaking news, news of death, news of loss all around us constantly. There is fear about what will happen tomorrow. But when do I say, okay, now it has become a bit too much for me to handle?
Yeah, it's just like in the first wave, we were talking about the mental health pandemic coming, it will come, it will hit us. So it silently came and it is just devastating the lives of the people. The simplest way how a person can know that there's an issue is sleep. If you're not trying to, taking a lot of time to sleep, like lying on the bed and getting the sleep, it is more than half an hour or 1 hour, or you're just browsing through the Facebook or Instagram or other social media, and when you get up in the morning, you're not fresh, or you feel like a little bit tired, or if your thoughts are overwhelming about a lot of thoughts overwhelming you, then if this continues for say 3 or 4 days, then that means that, okay, there is some issue going on. Better reach out to one of your family members, even after speaking to them. If you feel that the sleep issues are not being addressed, then that is the time when you have to reach out to a mental health professional. Probably sleep is the one which everybody would be having issues, and in the last, say, in the 1.5 year, the amount of all the, even despite anti-anxietics and antidepressants, the amount of the sleeping tablets, the sales of sleeping tablets has increased enormously, and the stocks of the sleeping pills in majority of the pharmacies are running out of stock. So that shows that yes, sleep is a major issue, and if you feel that the sleep is disturbed, at least for say more than a week or 10 days, then that's the time when you need to reach out to your mental health professional or any doctor nearby, or any help you can get in the nearby vicinity.
I want to just highlight this point because I think it's a very strong indication, and this is what we started off with, and I take it back to Dr. Deepti. Dr. Deepti, the fact that the sales of some of these drugs have gone up so much that some of them are not even available in the market. To say that, pills that will help you to sleep better, the sleeping pills, are not available in the market is a very, very alarming sign.
Yes, absolutely. The sales have gone up. We have seen a surge in the number of patients who are requiring help. Apart from anxiety issues, depression issues, all mental health issues, I think one another culprit for these sleep issues is the use of screens. The way people are using Facebook, Netflix, OTT platforms, I think that has become the sole source of entertainment for people in the absence of, being able to go out of the house. And the use of screens has also led to a lot of sleep issues. And I think even to solve those issues, people are now taking medications without the consultation of proper professionals, which is very dangerous because these are all medications which should be administered only under the guidance and prescription of a mental health professional or a psychiatrist or somebody who's trained in this. So I think that is an alarming sign. And today through your program, I would like to definitely tell people that do not take medications like this as if paracetamol for fever. Please do not take medicines like this. It is harmful sometimes if you're taking without supervision.
Yes. Absolutely. In fact, I wanted, that's why I picked it up, because I wanted this to be highlighted by our experts, that this is also a very, very dangerous and it's a slippery slope. You may think that, once or twice you self-medicate and it won't be a big deal and you'll be able to overcome this, but it may become another big problem for you as well. Thank you so much to all of the panelists who've joined us. Alarming signs of something that we've been saying is becoming a bigger and a bigger issue. The pandemic has only aggravated the aspect of mental health for us. And at some point now, the governments will also have to start looking at it seriously in terms of better policy, creating more infrastructure, bringing in more experts and spreading more awareness so that people know that they need help and what kind of help is required. Thank you for joining us.